afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response effort. Joining me again is interpreter Francis Beaurivage. Thank you again, Francis, for joining us today, and thank you to all of you for tuning in, and to the media for being here to cover the latest information about what is happening here in Lincoln and Lancaster County. We want to remind everyone to please visit our website at covid19.lincoln.ne.gov, where you can learn more about the cases in our community, and that is available through our new data dashboard that is updated both in the morning and in the afternoon. We will report today that in addition to the 2 cases that we reported this morning, there have been an additional 19 individuals in our community who've been diagnosed with COVID-19. So that brings us to a total of 21 individuals who have tested positive here in Lincoln today. Of the grand total of 530 confirmed cases in Lincoln, 249 of those, or nearly 47%, have been reported in the last 7 days. We again want to extend our love and sympathy to the friends and family of the 2 members of our community who have passed away from COVID-19. Here to discuss more details about the Health Department's investigation of our cases in our community is Health Director Pat Lopez.
Good afternoon. I want to again highlight the great work of our contact tracers. The Health Department has 16 of our public health nurses working on these investigations, and yesterday we added 11 nurses from Lincoln Public School. This work is making a big impact in reducing the spread of the virus by identifying close contacts and providing instructions and guidance to quarantine. Additional contact tracing investigations have now identified 192 Lancaster County residents who are positive cases related to the Smithfield plant in Crete. 112 are employees at the plant and 80 are family members or other direct contacts. Of all the positive cases investigated in Lancaster County, 41% have been connected with the Smithfield plant in Crete. The Health Department also works with employers to explain the process and importance of following our guidance. We also work with them to implement strategies to better protect their workforce and the public. The larger employers in our county have been very good to work with and have been proactive in protecting their workers. The number of positive cases related to the Smithfield plant in Lincoln remains at 9, 6 are employees and 3 are close contacts. 10 cases have been traced to the Smart Chicken in Waverly, 5 are employees and 5 are close contacts. The overall positivity rate for Lancaster County is 9.2%. The state rate is 17.8%, and the national rate remains at 18%. Today, our local hospitals reported 38 COVID-19 patients. That includes 12 from Lancaster County and 26 from other parts of the state. 6 patients are on ventilators. That includes 2 from Lancaster County and 4 from other parts of the state. Our hospital capacity in Lincoln remains healthy. Bryan Health and CHI Health St. Elizabeth drive-through testing sites completed 186 tests. That's just 62% of our capacity. So if you have symptoms of COVID-19, you can get tested now. The process starts with the easy online risk assessment at chihealth.com or bryanhealth.com. Again, you must have an order from Bryan Health or CHI Health St. Elizabeth or a doctor to be tested at the time. Test Nebraska also began testing at the Lancaster County Event Center in Lincoln today. For more information on that testing option, you can visit testnebraska.com to complete a risk assessment and see if you're eligible for a test. You must have an order from Test Nebraska to be tested at that site. I also want to again thank our business community for working with us on the guidance documents for different types of businesses. We have incorporated their input, and those documents are now available on the city's COVID-19 website. There are specific requirements and guidance for restaurants, barbershops, hair salons, massage therapy, nail technology, and body art establishments. Other guidance is available for child care facilities, the faith community, farmers markets, and general businesses. Our businesses and our other local institutions have been compliant, supportive, and patient. They have been very receptive to the new requirements, and they have been proactive in implementing preventative strategies. By working with our community partners, we have developed guidance for them that accommodates business needs while still protecting the health of employees and the public.
Thank you, Director Lopez. First, I'd like to thank Lincoln's businesses and nonprofits, faith leaders, and our community as a whole for taking so many steps necessary to help flatten the curve and prevent the spread of COVID-19 in our community. Your efforts to support teleworking and virtual services, physical distancing, and limited or paused operations have bought us time to prepare rather than overwhelm our healthcare system and to protect our most vulnerable residents. We urge you to continue these efforts given the risk level for the spread of COVID-19 in our community, and we've been heartened by the conscientiousness of so many who are demonstrating that they plan to resume operations closer to June 1st. And with the limited resumption of some business operations allowed by the state next week, however, we want to stress that here in Lincoln, we still need to move forward with caution. This is especially true for medically vulnerable people, such as people 65 years or older, people who live in a nursing home or long-term care facility, anyone with an underlying medical condition like chronic lung disease or moderate to severe asthma, people who have serious heart conditions, or people with diabetes. In addition, large public gatherings or events will still not be allowed as the directed health measures preserve the 10-person limit for most settings. This limit on public gatherings is a significant and critical component of the directed health measures going forward. The other critical way in which we increase our safety during this pandemic actually has nothing to do with directed health measures because it relies on all of us to make critically important lifestyle adjustments that protect ourselves, our family, our friends, and our community. And that is the extent to which each of us faithfully maintain physical distance from others, wash our hands thoroughly and frequently, practice good hygiene and disinfect highly touched surfaces, limit non-essential travel, work from home to the extent possible, and wear face coverings. All of us still need to continue to practice these proven strategies to help prevent the spread of COVID-19. And these prevention measures are going to become more and more important as we learn to coexist with this virus for some time. It may be months or years before a vaccine is developed and widely distributed. So we should look at this period not as a temporary step, but as our now normal. This risk of failing to practice physical distancing, good hygiene, and other such practices is not merely a health risk. It is also an economic risk. The degree to which we adhere to these personal prevention measures will determine the degree to which we help save lives and livelihoods. With that, I would like to introduce Dr. Bill Johnson to discuss one of the most important personal prevention practices that we have at our disposal, face coverings. Dr. Johnson is a community pulmonologist with Nebraska Pulmonary Specialties who is board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine. He serves as medical director of the sleep lab at Bryan Medical Center, pulmonary hypertension clinic at Bryan Medical Center, and the ICU and intensivist program at Bryan Medical Center East. He's a member of the American Medical Association, the American Thoracic Society, and the American College of Chest Physicians, the Nebraska Medical Association, and our Lancaster County Medical Society, among other organizations. Thank you so much, Dr. Johnson, for joining us today.
Thank you, Mayor, for asking me to speak here. I appreciate all that you're doing for our community. And I want to congratulate Nebraska, as I have before, on how you have self-distanced, how you've maintained the policies that we have up to this point, and how you've flattened the curve. You truly have saved lives up to this point. You have made it easier for us in Nebraska from a healthcare provider perspective. but this disease does remain a very real threat to us. As a physician, when people have an illness and we give them a diagnosis, oftentimes there's a process they go through that first off denial and some anger and some bargaining before they finally realize this is what it is. And we're actually seeing that happen on a global perspective here. People can't believe that this is happening. They're angry about it. We try to bargain about it and maybe do things that we shouldn't until we come to a point where we realize this is what we really need to do. I've spoken with Dr. Jocelyn Herstein at Nebraska Medical Center several times. She's an infectious disease expert in public health, probably the state's expert. There are two key features about this that we have to understand before we can, and we have to accept before we can really move forward and be successful here. Number one is we have to control the asymptomatic carrier. If we ignore the asymptomatic carrier, by the time that person transmits disease to others, it's too late. And we have to remember that this is a respiratory disease. This is spread with respiratory secretions through the air from our breathing. Those two things are key. And because all of you have helped us, we want to be able to help you and help understand why we are saying what we want to do. We want to apply what we do in the hospital into a public fashion that could be successful, that has shown success in the past. We call it universal precautions, and it's the same thing from a public perspective. And the mask wearing is so important from all of this. On our first slide here, it shows two people who have a carrier and a healthy person, both of them without masks. The transmission rate in that circumstance is extraordinarily high. Even simply with the social distancing and standing 6 feet apart, there's still a high transmission rate if somebody has COVID. Think about the possibility if you're in a business and somebody gets infected and it's been 3 or 4 days that that person has actually had that disease and spread it. The asymptomatic person is critical, and that's why as we go on to the next slide, as doctors, we used to think, well, if I protect myself, I'll wear a mask. But we found here with this disease that this doesn't work. That's where the N95 came about, why we felt we needed the N95 to try to protect ourselves here when that COVID patient came in and was not protecting and was aerosolizing things. But obviously N95s are not always available. We also found out that if you have the person who has COVID and they wear a mask, that we found out had tremendous benefit, actually. It had way more benefit than the provider wearing a mask. That's why when you go to the hospital, if you have COVID, the word is from the hospital, put on a mask before you come in. That's vital to that. This drops the transmission rate drastically. But even better is if we go to the last slide, both of you wear masks. The effect of transmission, if both people wear a mask, becomes negligible. And the point I'm making here is that everybody has to assume that they are an asymptomatic carrier. You've got to be able to protect the other people in the room. This is not about protecting yourself. This is about protecting the other people in the room. I've shown the sign of this, and to her in this language, this means love. But in our situation today, what this means is I care about you. And I'm wearing my mask for you. And that's what we're asking. We want you to think about the other person with this. If you've watched any of the Brian Press briefings in the past, I have begged, I have pleaded for people to wear a mask. Today, the time has come, and to Nebraska, I'm challenging you. It's your turn. You're about to become the front line. You're about to have your chance to be a hero. And the definition of a hero is that you are thinking of the other person in the room more than you are yourself. We have to do that if we're going to battle this disease and we're going to do it successfully. It's your chance. You need to get rid of the denial. You need to get rid of the anger. You need to get rid of the bargaining, and you need to take this disease for what it is. It doesn't negotiate. If you do that, we can be successful. This is a tragedy, but we can turn it into a success story. And the people of Nebraska truly could end up saying that There really is no place like Nebraska. Thank you.
Thank you so much, Dr. Johnson, for that powerful presentation. I hope all of you will share his message of how we can all be heroic in our efforts to protect ourselves, our loved ones, our neighbors, and our larger community. We're going to close today with some good news about local entertainment, courtesy of the Journal-Star's longtime reporter and editorial board member, L. Kent Wolgamott. Friday nights have always been a popular time to enjoy local bands at many of our live music venues. Our local music community has been very creative and innovative in finding ways that the public can continue to support the venues and talent we have here in Lincoln. A live streaming concert last week that featured 18 local artists and DJs raised $4,500 to support 5 venues. And thank you to Lincoln musician Josh Hoyer, who organized the Mayday Mayday Link Music Venues in Crisis event. Thank you as well to all the performers and to all who support this great effort. Another effort to support local musicians and venues is the Lincoln Strong live streaming concert series that we've featured before. You can find the concerts every Thursday evening at the Lincoln Strong Facebook page. And finally, so many of us miss enjoying the best artists in the world who've come to our Lead Center stage. We can't see Canadian artist April Virch at that beautiful venue right now, but you can enjoy watching her from your own homes tonight when she is featured on the Lead Live online streaming concert. The performance by the fiddler, step dancer, singer, and songwriter begins at 7:30 on the Lead Center's Facebook page. And with that, we will open it up for questions from the media.
Mayor,
Riley
this is
Johnson.
Bill with 1011.
Hi,
This
Bill.
might be better for Pat. I'm not sure. Earlier this week, you guys had mentioned that there was hope for some recovery data this week. I was wondering if there's any news on that.
She'll be right back.
Hi, Bill. We're working on that with the case numbers that have come up, and I'm hoping, our plan is early next week we should have that for you. Probably, I would say, by Tuesday or Wednesday. We've just had an influx of cases, as you've seen, and so we have to go back and collect some additional data, and we want to make sure our data is correct, as we always do. So you can plan on having that. We're working hard on it.
Director Lopez, Riley at the Journal-Star.
Yes.
Could you speak to, could you speak to the length of the new DHM? And are there any sort of guidelines that are unique to the county as far as what's in place in the state right now, particularly with face masks?
Yes. The main differences between our DHM and the state DHM is the requiring of servers and restaurants to wear face masks, the face coverings in all areas. That's one area where we differ. We also have some difference in the cleaning elements required both in high-touch services. That's something restaurants do really well, but we're asking our other service areas to do the same thing. So those are primarily the main things, as well as we're asking the businesses to check temps and ask about signs of illness before people start their workday. That's the one that will be in effect.
When does it run until?
June 30th. And those
Director Lopez,
yes.
with the Smithfield outbreak in Crete, do you have any sense, based on your conversations there, whether there are going to be further tests done of those employees, or if most of them have already been tested? Do you have any sense for where they are in measuring the scope of their outbreak?
Well, I think, they had testing done again Wednesday and Thursday. I don't have all those numbers, but we were at over half of the employees being tested when I spoke with the health director at Public Health Solutions. And I think Smithfields will continue to test as long as it's necessary.
Pat, I have a question from Channel 8. You said earlier this week the health department was monitoring situations at some Lincoln care facilities. Any updates on those situations? Yeah, I think he may be talking about long-term care facilities.
I think so. I don't have any updates today or any changes to report on that for long-term care.
Any other questions from the media?
I have one quick follow-up, Mayor. This is Bill again. Is there any thoughts on making mask wearing mandatory for all businesses that engage with the public, for example, a butcher's shop or people at a grocery store?
I haven't been a part of that discussion, but what you can tell for sure is that we think that wearing face coverings is absolutely an essential component of our strategy to prevent the spread of COVID-19. And we urge the public, whether you're an employer or a worker, a child or an adult, as long as you're a child over the age of 2, because we don't want to prevent breathing issues for younger children, but we urge you to wear face coverings as part of a demonstration of love for your family, yourself, your neighbors, and our community. Just like Dr. Johnson said, this is how we can really effectively reduce the spread of this disease. And it won't last forever, but as long as we're in this time period where we don't have a vaccine, this is going to be an essential component, perhaps the most important strategy that all of us can undertake in order to prevent transmission of this lethal virus. And I'm going to let Pat Lopez come back up. She has something else to add.
And Bill, I haven't been out to a lot of places, but I do know from talking to our grocers, they are following guidance. And I think if any of you go into a store, you'll see that all the employees are wearing face coverings or masks. So kudos to them for setting a good example, taking care of their employees, and now we need to do the same when we go in by wearing our masks.
Any other questions? If not, thank you so much for tuning in. We wish that you and your loved ones stay healthy and stay connected, and that you invest in a face covering for yourself and for our community. Thank you.